When writing a prescription, strict adherence to formatting rules is an absolute requirement for both legal compliance and patient safety. This briefing covers three critical areas: the mandatory structural elements of a complete prescription, universally banned abbreviations, and the vital risk classification scales you must check before signing. An ambiguous document is a preventable threat to human life. We do not tolerate errors in transcription. This diagram breaks down the four anatomical quadrants of a standard prescription. The top half contains the superscription, which records the patient, physician, and date, along with the inscription, which specifies the exact medication and the dispense quantity. Moving to the bottom half, we find the subscription. These are your explicit directions to the pharmacist. Finally, the signature block contains the physician's sign-off and registration number. Omitting any of these four foundational pillars automatically renders the document invalid. The pharmacy will not fill it. This checklist details the mandatory items required within those four quadrants. You must document patient identification, patient-specific information like allergies, precise medicine details, and authorized refill parameters. You must also provide clear prescriber identification. Notice the warning regarding the date. A missing date legally voids the prescription the moment it is written. This warning graphic illustrates the strict security exception for controlled substances like morphine. The dispense quantity must be written out twice, first in numeric figures, and then spelled out in words immediately adjacent. These redundant quantity rules and mandatory checklist elements are explicitly designed to prevent tampering, forgery, and unauthorized dispensing at the pharmacy level. This reference table identifies legacy medical abbreviations that are now strictly banned. You cannot use shorthand like QD, MSO4, or U. You must write out their full text replacements, such as daily, morphine sulfate, or unit. The final row highlights strict mathematical formatting rules for decimals. Trailing zeros are forbidden because they are easily mistaken for whole numbers, while leading zeros before a decimal point are mandatory. Beyond formatting, you must evaluate interaction risks. This chart displays the 5-tier classification system for drug-drug interactions, scaling up from A, indicating no known interaction, to X, where you must avoid the combination entirely. A parallel rating system applies to the FDA pregnancy category shown here. Pay close attention to the pivot between Category C, where the benefit may justify the risk, and Category X, where definitive fetal risk dictates you must avoid the drug completely. Standardizing our abbreviations and rigorously utilizing these risk scales eliminates the subjective guesswork that leads to fatal dosing errors. This tablet screen shows a flawless example of a complete prescription. In the upper half, we verify the date, diagnosis, patient info, and precise drug dosage. Scanning the lower half, instructions are unambiguous, and the document is finalized with a registered signature and PMC number. Executing this uncompromising standard on every single prescription is your ultimate legal requirement and your ethical responsibility.